one other aspect of the way that the private sector is now doing more and more of the NHS work is that outsourcing moves where the money is. An example is the way that the mental health services in Norfolk, when faced with the government pressure for the NHS to save £20 billion between 2010 and 2015, they decided that they'd cut beds and cut staff early on so that they could make those savings and develop community services instead. Unfortunately, it didn't work out that way, so as soon as they'd made those cuts under pressure from the government, they found that they did need those beds and they did need the staff, so they had to use private sector beds and they had to use agency staff with increasingly severe effects on their budget. Now, at this stage, they're very aware that they're hemorrhaging money because they have to send patients needing beds to a private bed wherever it may be, anywhere in the country. And people are being sent out of county despite the best efforts of the local mental health service to bring them back into county. The way they have been doing that, though, is to use a private mental health hospital, one which is still in special measures after an inspection by the CQC. 145 patients were sent there last financial year. There is no money in the pot to start building new or opening new NHS mental health beds. There's plenty of money in the private sector pot, where the companies there see an opportunity to make yet more money from the NHS, and they are opening more mental health beds across the country.